Antibiotics, as we know them, started with the discovery of penicillin by Sir Alexander Fleming in 1928. Antibiotics were first prescribed to treat serious infections in the 1940s and have saved millions of lives since then. Penicillin was used to control bacterial infections among World War II soldiers, but by 1945, penicillin resistance became a substantial problem and the first warning of antibiotic overuse was given. By the 1950s, even with the development of other antibiotics, antibiotic resistance was a real problem. The first case of methicillin-resistant Staph aureus, or MRSA, occurred in the United States in 1968. According to the Centers for Disease Control and Prevention, or CDC, in 2015, there were 269 million antibiotic prescriptions dispensed from outpatient pharmacies in the U.S., which is enough for 5 out of every 6 people to receive one antibiotic prescription. At least 30% of the antibiotic prescriptions written are unnecessary. There are 47 million unnecessary antibiotic prescriptions written in the U.S. in doctors' offices and emergency departments each year, most being for respiratory conditions that are most commonly caused by viruses or other bacterial infections that do not always need antibiotics, such as acute sinusitis. There were 6 million antibiotic prescriptions written to treat acute sinusitis in 2015 alone. The CDC recommendations for prescribing antibiotics for acute sinusitis are severe symptoms, longer than 3 to 4 days, which includes a fever greater than 102 and purulent nasal discharge or facial pain. Persistent symptoms longer than 10 days without improvement, including nasal drainage or daytime cough, or worsening symptoms for 3 to 4 days, including worsening or new onset of fever, daytime cough, or nasal drainage after initial improvement, which is also called double sickening. Okay, so what? What does this mean? Well, at First Care Clinic, there were 8 prescribers which diagnosed 375 patients with acute sinusitis in February of 2018. 80 of those charts were reviewed by myself, 10 charts from each full-time provider, and an antibiotic was prescribed 78% of the time, with 54% falling outside the recommendations for prescribing by the CDC. The reason I chose this learning need is because I feel all providers should make every effort to reduce the amount of unnecessary antibiotics written for acute sinusitis in order to reduce the likelihood of antibiotic resistance. First Care Clinic is an urgent care clinic with 13 clinics scattered across Kentucky and southern Indiana. Providers at First Care treat a variety of walk-in injuries and illnesses, including acute sinusitis. First Care Clinic in London, Kentucky is staffed by 7 nurse practitioners with master's degrees and 1 nurse practitioner with a doctoral degree. The nurse practitioners vary in range from 28 to 53 years and include 7 females and 1 male. All practitioners practice independently, are Caucasian, and speak English. The experience levels of the nurse practitioners range from 2 to 10 years, with mostly previous experience in the emergency department as an RN. The goal of this lesson is to increase nurse practitioner knowledge and application of evidence-based antibiotic prescribing for acute sinusitis at First Care Clinic. By the end of this lesson, the nurse practitioner will be able to identify the risk factors for the development of acute sinusitis, as evidenced by scoring at least 80% on a post-test, identify indications for prescribing an antibiotic for acute sinusitis, as evidenced by scoring at least 80% on a post-test, and following recommendations for prescribing antibiotics for acute sinusitis, as evidenced by 90% adherence to recommendations in charts with a diagnosis of acute sinusitis reviewed in the month following this lesson. I will be employing PowerPoint, lecture, and open discussion for my lesson. PowerPoint presentations are cost-effective, can cover large amounts of information quickly, and can present information to a large number of students at once. PowerPoint, along with lecture, allows ongoing interaction with students in the form of discussions. The first article is a study on the measurement of learning outcomes, comparing PowerPoint presentation to problem-based learning with discussion amongst fifth-year medical students. The purpose of this study was to see which method of teaching was more effective, PowerPoint with lecture or problem-based learning with lecture. The findings showed there was significant clinical improvement of learning between pre- and post-testing in both groups, but no significant findings when comparing the two. The second article discusses the effect of PowerPoint and traditional lectures on nursing students. The purpose of this study was to assess if PowerPoint with lecture in teaching is better than lecture alone. The results showed that students who had lecture alone scored higher on post-test scores, but the findings were not clinically significant. The third article is a case-controlled study using nursing students taking two separate surveys, one on chalkboard presentations and one on PowerPoint presentations. The results were 97% of the students preferred the chalkboard method and 86% preferred the PowerPoint method of instruction. The findings were not clinically significant though, and therefore the researchers concluded that both methods are effective instructional aids in nursing education. The last article is a study that was conducted to assess which methodology of teaching anatomy was preferred by students, chalk and blackboard, computer-assisted, or both when combined. A semi-structured questionnaire-based study was given to 250 students who previously attended lectures in anatomy at King George's Medical University in India. The results showed that 70% of the students preferred the combination of PowerPoint and lecture over one or the other alone. The conclusion was that lecture combined with PowerPoint should be used to combat the limitations of chalkboard alone. The review of the literature indicated that PowerPoint, when combined with lecture, is useful in teaching nursing students. PowerPoint is preferred over lecture alone, and that PowerPoint can be used in a variety of settings. My rationale for using this method is it is cost-effective, easily constructed, and graphics and images can be included. My learning theory is constructivism, which discusses that learning is meaningful, the learner's previous knowledge is what is built upon, learning is a lifelong process, and the student and the teacher have an active dialogue. Constructivism theory is taught easily by PowerPoint, lecture, discussion, and handouts. So why does this methodology work for my audience? With this methodology, the learning is meaningful, understanding, and adaptation leads to new knowledge. Previous knowledge of the learner is foundational for new knowledge. The student and teacher keep an active dialogue. There are multiple ways to assist in creating knowledge and understanding, and it induces collaboration with peers, and it is suited for scientific knowledge. The presentation content will be performed by a PowerPoint presentation, lecture, and discussion, and I will allot 30 minutes to present. The content will contain the background on antibiotics, statistics on antibiotic use, the results of provider chart reviews, epidemiology of sinusitis, risk factors of sinusitis, and symptoms of acute sinusitis. I will discuss the recommended antibiotics and other treatments for acute bacterial sinusitis, and I will revisit First Care's clinical practice guideline on acute sinusitis, and I will discuss and give websites for additional tools for patient use. A post-test will be given to all participants to assess learning. This should take about 10 minutes. Listed are the websites for additional information for providers where printable educational resources are available to give to patients. Additional information on antibiotic prescribing in the outpatient setting is also given, and a site where CEUs on antibiotics can be obtained for free. These are the resources I used for my teaching content. To evaluate the knowledge gained from my presentation, I will use a post-test that consists of 7 multiple-choice questions. A copy of the PowerPoint will be given to each attendee prior to handing out the test. The questions I will use are listed here. The last 2 questions will evaluate my teaching method. So here are the additional resources that were listed within the teaching content as well. Here is one page of my references. And here is the last page of my references. Thank you so much for your time. Have a great day.